Good afternoon, and thank you again for joining us for today's webinar, SOAR, SSI, SSDI Outreach, Access and Recovery, another piece to the puzzle for ending homelessness. Today's presenters are Michelle Baxter and Karen Ulp. Michelle has worked for PA DHS since 2009, starting in unemployment compensation and then working as an income maintenance caseworker at the Lancaster County Assistance Office. In August 2013, Michelle advanced to the Office of Mental Health and Substance Abuse Services, Bureau of Policy, Planning, Program Development as a Human Services Program Specialist. Michelle serves as a state path contact and administers PA's projects for assistance in transition from homelessness, PATH grant. In addition, she is the state team lead and lead trainer for PA's SOAR initiative. Karen Ulp. Karen's career in human services spans 30 years in both private and public sectors, and she is in her 17th year with Pennsylvania's Department of Human Services. Currently, she is a human services program specialist with a focus on housing in the Office of Mental Health and Substance Abuse Services, Bureau of Policy, Planning, and Program Development. She previously worked for the Commonwealth in social and rehabilitative services at Harrisburg State Hospital and Laurel Center. She holds a Master of Science degree in Community Counseling from Shippensburg University and a Bachelor of Music degree in Music Therapy from Mansfield University. Thank you everybody for joining us today, and thank you Michelle and Karen, and I'm going to turn the presentation over to both of you. Wonderful.
Thank you, Colleen, for that great introduction, and thank you to the Housing Alliance for having us here today to speak to you about SOAR. As you'll pick up throughout the presentation, we're a little passionate about this topic, so forgive us if we kind of speak a little quickly or go through some things in great detail, because that's just what we do. As Colleen mentioned, we will be giving out the PowerPoints after the presentation. We'll also be referencing some handouts that will be coming along with that PowerPoint as we go through. But the biggest thing I just want to start off with is noticing the people on our dividing slides. While it might not seem like a whole lot to anyone, oh, it's just a divider, these are actual SOAR applicants. These are people that have gone through the application process with a SOAR person and have had very positive results. So I like to, in addition to all the words we're going to give you today, just to give you a picture to help put a framework to our SOAR process. Our purpose today is twofold. We are going to make sure that we outline the advantages of using SOAR, and that can be for your area or for statewide, and we also are going to let you know how to become SOAR-trained. First, we're going to do an overview and give you some of the why behind the SOAR process, why this is an important thing for everyone to learn. So what is SOAR? SOAR is a model. SOAR is a way of doing your application correctly the first time. Why do you want to do that? For those of you who might not know, there is a long waiting list for appeals. We're looking at 18 months or more of wait time for appeals. So if you get your application approved on the initial application, especially for those that are in dire need, that is a much better situation for them. As far as who SOAR can help, that's for individuals who are experiencing or at risk of homelessness that have a serious mental illness, co-occurring substance abuse disorder, or a serious physical disability. Now, everyone has different definitions of everything. We'll just go with that. But as far as SOAR, we are a little more flexible on our definition of homelessness and at risk. While we usually follow the guidelines for HUD, Housing and Urban Development's definition of homeless and at risk of homelessness, I'd like to point out that we're not talking about chronic homelessness, but we are focusing on just homelessness. So this is going to be those people that are in emergency shelters, transitional housing, places not meant for habitation. They don't have a place after the next 14 days when they're going to be exited. People of that nature. As far as the risk of homelessness, again, HUD will say below 30% of the median family income for the area. or don't have sufficient resources or connections to continue their habitation. But the thing I'd really like to point out for a potential SOAR applicant is that SOAR is also appropriate for those people who are being served by various programs such as the VA's Supportive Services for Veterans Families, the Department of Housing and Urban Development's VA Supportive Housing, Housing First, and some other permanent supportive housing programs. So it's a little bit broader than most people would think of, and I just want people to realize that because SOAR is definitely a program that should be applied to the widest group possible. As you can tell, we are a program that is sponsored by SAMHSA, Substance Abuse and Mental Health Services Administration, and SOAR does exist in all 50 states and DC. So just to get started on some basic information, for those of you who might not realize, SSI is a program that is based on need. So if you have low income, low resources, that's where SSI comes in versus Social Security Disability, which is based on how much money you've already paid into the system. Currently for 2019, the monthly amount for supplemental security income, SSI, is $771. And obviously the amount that you would get for SSDI is based on your earnings history. Date availability is a little bit different for those on SSI. That depends on your protective filing date and your application date. Whereas with SSDI, you're going to have your date start on the date of onset of the disability with a 5-month waiting period. The other difference between these two programs is the type of health insurance. When you get SSI, you automatically get enrolled in Medicaid services, but for SSDI, you're enrolled in Medicare, but keep in mind that there's often a 2-year wait period where you have to fend for yourself as far as medical needs, and sometimes that's a very difficult time frame, so bear with these people. And one other thing I'd like to point out as we're going through the slides is you'll see down at the bottom where we actually have our reference information. So if you want to go and learn a little bit more in depth about the topics that are on hand, that's where you can go and find those. So we're back to more different definitions. Social Security, what we're trying to do with the SOAR process is prove that the person that is applying cannot work to get a substantial gainful employment. So in Social Security terms, they're looking at the person is unable to make $1,220 a month. And that could be because of a medical condition, psychological condition, or a combined problem. Keep in mind, too, that no Social Security benefits can have a substance use disorder as the primary diagnosis. It's sort of like working with your county assistance offices where you can't have alcoholism or heroin addiction as your primary diagnosis. It has to be something else with the substance use as a secondary. So for SOAR, we're obviously going to look at the diagnosis, documentation, and duration because these are the factors that Social Security will look at. And we have to prove that the person can't make that $1,220 a month because of the severity of the impairment and its effect on the work.
This is Karen. Since my work is in housing, I like this visual. SSI, SSDI is just one block or component to reach the overarching goal of achieving wellness and recovery. When someone obtains SSI, SSDI, it will help them secure housing and remain stably housed. It will help them secure insurance for treatment services and supports that recovery is not only possible but probable. And this reminds me of Maslow's hierarchy of needs, where basic physiological safety needs must be met in order to move through the other stages of social belonging, self-esteem, and self-actualization. Obtaining SSI, SSDI benefits leads to access to health care and a decrease in adverse outcomes such as frequent ER admissions, hospitalizations, and incarceration. And for housing providers, if someone has income, they are able to pay a portion of their rent, so that can help to ensure sustainability for your program as well. So how do states and communities benefit? If you don't have a SOAR program but want to pitch the idea to the decision makers in your organization, it's helpful to talk about the financial benefits. In 2018, $406 million in cash benefits and back payments received by individuals is spent in local communities. And that $406 million is derived from the SSI federal benefit rate from 2018 at $750 times the 12 months times the over 45,000 in approvals nationwide. Health providers, states, and localities all benefit from SSI, SSDI, and Medicaid, Medicare insurance coverage.
So we've given you a little bit of background on the what, the who, and the why of SOAR. So now we're going to show you a little bit of how SOAR actually works. The video that we're about to show you is going to differentiate a lot between using the SOAR process versus the regular application methodology, and we'll talk a little bit afterwards about what these differences are.
We'd like to talk about the process that the Social Security Administration, SSA, and the Disability Determination Services, DDS, use to process disability applications. This disability determination process has some common elements that are present for the majority of initial applications. However, every application is unique, and a number of things may delay the process for applicants whose applications are not complete or who do not have sufficient medical evidence to document their disability. SOAR works to develop complete applications, provide quick follow-up, and ensure ongoing communication with SSA and DDS. Using SOAR, we can help shorten processing times by submitting medical records with the application, as well as a medical summary report that provides a complete picture of the applicant's ability to function as it relates to work. We're going to take a look at the conventional process and compare it to the SOAR process to show you what a difference SOAR can make. The process begins when a service provider receives a referral or meets someone for the first time. The conventional service provider and the SOAR provider will likely begin in similar ways. They will contact SSA to set the applicant's protective filing date. The conventional provider will do this either by calling SSA, starting the application online, or going into the local office. All of the conventional methods are also available to SOAR providers. In addition, some areas have established a process to fax the SOAR consent form to the local SSA office, indicating the applicant's intent to file. This is where the paths begin to diverge. The conventional service provider will likely give the applicant bus fare and directions to the local SSA field office and encourage them to attend their appointment as scheduled. It is not uncommon for the applicant to miss this appointment, which must be rescheduled. The applicant will then sit with the SSA claims representative and verbally provide as much information as possible. There are often additional required supporting documents that the applicant does not have, which must be brought to the field office on another visit. The application may or may not be flagged as homeless. The SOAR provider will begin an intensive interviewing process to collect complete historical, medical, and functional information from the applicant. The applicant will sign authorizations for the SOAR provider to collect their medical records. The SOAR provider sends those requests out to all of the applicant's treatment providers and continues to follow up for new information. The SOAR provider will complete the SSDI application and the disability report online. They will complete the SSI application on paper and have the applicant sign an SSA 1696 appointment of representative form and an SSA 827 authorization to disclose information. Within 60 days of the protective filing date, the SOAR provider will have completed their medical summary report and compiled all available records. they will make an appointment to hand deliver this complete packet to the local SSA office. The SSA claims representative will flag the application as a homeless claim and add SOAR to the remarks section of the electronic file. The next steps are the same for both applications. The local SSA office will make a non-medical decision for SSI and SSDI eligibility. If the applicant is eligible for one or both of the programs, the application will be electronically transferred to the state-operated Disability Determination Services, or DDS, where a disability examiner is assigned. In some states, the SOAR application will be assigned immediately to an examiner who specifically handles SOAR claims. It is important to point out that if the conventional application was not flagged as homeless, it may take longer to get to the DDS and to be assigned to a disability examiner. The disability examiner will look at the SOAR application and review all of the evidence in the file. If they have any questions, they will contact the SOAR provider who submitted the claim as the applicant's appointed representative. If additional information is needed, the SOAR provider will quickly provide it. The disability examiner will be able to make a medical decision on the application and return the electronic file back to the originating SSA field office. SSA confirms the decision and notifies the applicant and the SOAR representative of the decision by letter. Once the conventional application is assigned to a disability examiner, they will begin collecting medical records from the sources listed on the disability report. They will send a request to each treatment source and then wait for the records to be returned. As they start to receive the records, they might notice another treatment source and send an additional request to the new source. Once they have gotten the records, they may decide that they do not have enough information to make a decision, so they may schedule a consultative exam with a contracted physician. Often, applicants who are experiencing homelessness don't have transportation or don't get the appointment notice, and so they do not make it to the scheduled appointment. They must then call the examiner and have the appointment rescheduled. The applicant attends the rescheduled consultative exam, and the consultative examiner has 30 days to complete their report. In the meantime, the disability examiner will have mailed a function report to the applicant and possibly a third party to complete. The examiner may need to contact the applicant to remind them to return their completed function report. An applicant without a phone or stable mailing address can be difficult to get in touch with. When the disability examiner finally has enough information to make a medical or disability decision, they will do so and return the electronic file to the local SSA field office, where SSA will confirm the decision and notify the applicant of the decision by letter. As we hope you can see, providing complete information up front and maintaining ongoing communication with both SSA and DDS will result in applications submitted with a SOAR provider being processed much more quickly, enabling the applicant to start receiving benefits sooner.
I don't know about you, but after watching this video the first time back when I was first trained, my jaw was pretty much on the floor. When I saw the shorter, much shorter route and the more effective way of communicating with the population at hand, I thought, this is a no-brainer. This definitely shows us the advantages of using SOAR. And again, don't forget, we have the YouTube link also written out below in the blue strip. So now, I'm going to transfer things back over to Karen, and she's going to tell us a little bit more in detail about things that we just learned in the video.
So it's the SOAR-trained caseworkers that make SOAR work. The critical components on the right shows how the SOAR process is different. The SOAR worker uses the SSA 1696 form to be the appointed representative for assisting with the application, and this assistance includes collecting and submitting medical records with the application. The worker completes a medical summary report, which is unique to the SOAR application. It provides a comprehensive summary that shows a vivid picture of the individual's personal and treatment history and its impact on the person's life. It clearly describes the factors affecting functioning and ability to work. The medical summary report is made even stronger by having it co-signed by a physician or psychologist who has seen the applicant and reviewed the report. There is an MSR template to use, which includes 8 parts, including an introduction, personal history, occupational history, substance use history and treatment, physical health and treatment history, psychiatric history and treatment, functional information, and summary. It's always a good idea to review the application before submitting it. And the TA Center is really good at also reviewing the MSR summaries. And Michelle will talk about the SOAR training later, but the training goes into depth in all these components as well. SOAR workers take the time to complete a thorough application, and this pays off in the approval rates on initial application.
And I just want to add into that, when Karen was talking about the medical summary report, just as I was pointing out the faces of SOAR on our divider pages, that painting of the picture, that connecting the signs and symptoms of the disability to the person's inability to work oftentimes makes the difference. So we're actually bridging what's happening and showing a full-fledged painted picture to the Social Security's team and disability determination to see how this is affecting people. They don't have to draw the conclusions themselves.
SOAR cannot and does not function in a vacuum. We rely heavily on our community partners. First and foremost, the Social Security Administration is an essential collaborator. SSA is the federal agency that administers SSI and SSDI. Because SSA is federal, their eligibility rules are the same in every state. The SSA makes the non-medical decision on the claim. Every state has a disability determination service, and in Pennsylvania, it's called the Bureau of Disability Determination in the Department of Labor and Industry. The Bureau of Disability Determination makes the medical or disability determination. Medical and treatment providers are extremely important in this collaboration. The SOAR worker will need access to assessments, evaluations, and the corresponding medical records that support the claim. We have heard that some medical providers are charging for records. We never want to pay for records. This is where collaboration is critical to the SOAR process. SOAR workers can engage with the provider and explain that the applicants being assisted are experiencing homelessness or at risk and who have no income and are unable to pay. To make it easier for the provider, the SOAR worker could come to their office to pick up records or to copy the records themselves if possible. Many times records are sent to a copying service. Ask if the SOAR records can be copied in-house. Involving partners from criminal justice organizations, Veterans Affairs, employment and educational programs, housing providers, and others helps to ensure that individuals served by SOAR are receiving comprehensive services and supports, and that your SOAR program is not operating in a silo. This slide shows the SOAR leadership collaborative structure. I'll just point out a few of the main tasks that each group does. The SOAR TA Center is instrumental in providing technical assistance across groups and develops the online curriculum. They work regularly with the state team leads, which is Michelle in Pennsylvania. They provide feedback on the curriculum practice case and on actual applications, primarily feedback on the medical summary reports. The state team lead, again, is Michelle, and her contact information is in the PowerPoint. She is the liaison between the SOAR TA Center and the local leads. She submits local SOAR outcomes to the TA Center. She's extremely approachable and helps local leads develop cohorts. She helps problem solve any implementation challenges and answers specific SOAR case-related questions in collaboration with the TA Center. The local lead directs the local implementation plan and facilitates the SOAR online course cohorts, and they ensure quality applications and report outcomes. The SOAR case managers are most important. They complete the SSI and SSDI applications using the SOAR model and communicates with the local Social Security Administration. Case managers might have an agency lead that uses the online application tracking program called OAT to track outcomes and help supervise multiple case managers. This slide shows the numerous ways the SOAR TA Center supports the state, local, and caseworker leads. One very important benefit of becoming involved in SOAR is that you are never alone in this process. Michelle and I have found the TA Center's technical assistance to be very helpful. They are very responsive and provide TA whenever asked. The resources on the website are very comprehensive, including the online course, the online application tracking, and online library. SOAR TA Center website is jam-packed with information, and the handouts that will be shared after the webinar comes from their website library.
One thing to always know is when you get involved in the SOAR process, you're never alone. There are so many ways for you to get help, either in person or from resources, as Karen was mentioning, the online and databases and what we call issue briefs or white sheets. So definitely don't feel alone when you're in the SOAR process.
So why do we go to all the extra effort, and why are there so many supports? It's because SOAR works. We are constantly building the case for SOAR and demonstrate that through outcomes data. I'll focus on the initial application statistics here. In 2018, there was a 65% approval rate nationwide on initial applications, and that's compared to 10 to 15% approval rates for unassisted applications from people who are homeless, and 28.5% approval rates for all non-SOAR applicants. So it's a very significant jump in initial applications being approved. Also, on average, approval decisions are made within 100 days, about 3 months from submission of initial applications. It typically takes 2 years to receive an approval after initial outcome and appeals process is completed in a regular application process. SOAR workers are not required to do appeals, so that just to note that, and that might have some impact on the appeal numbers that you see here in the slide. And this slide shows nationwide statistics of cumulative initial approvals and appeal approvals equals 45,137 people receiving benefits because of SOAR.
So, as you can see here, Pennsylvania's efforts with SOAR have continuously ranked very highly nationwide. You can see right there that Pennsylvania is actually linked as the top state, and in order to be in the top 10, the criteria requires that the states have 300 cumulative decisions and have had approval rates at or above the national average in 2018. The average approval rate for these rock star states is 82%. Which, compared to that 10 to 15% of those people that weren't using the SOAR process, that's quite impressive. So, overall, I'd just like to say, if your agency is helping people apply for SSI, SSDI, and they're not seeing results between 65 to 82% in their approval rates, then they should be doing SOAR. So just contact us, and we'll see how we can get you started in that process. One of the big reasons that Pennsylvania has consistently rated so highly in national evaluation is because of the Homeless Advocacy Project, or HAP, in Philadelphia. HAP has been following SOAR since the Baltimore test pilot way back in the day. HAP actually has very qualified people and lawyers on hand, and they work with the Philadelphia Behavioral Health and Intellectual Disability Services, as well as the Department of Human Services in Philadelphia and the Office of Homeless Services. HAP will actually coordinate and receive referrals from these agencies and review the applications for high quality prior to submitting them for review. So the approval rate overall in initial applications since HAP has started doing SOAR is an amazing 98% in their 2,234 applications completed. And in 2018, they averaged only 58 days to decision. Another way that Pennsylvania is reaching out to spread SOAR further and further is collaboration with the VA and SSVF. Previously, the VA staff was not supposed to work with SOAR applicants because it was against the VA's rules, but then in 2017, there was a new memo released in which the VA highly advocated and strongly encourages the use of SOAR with any of the caseworker information that is being submitted for SOAR applications. One thing to keep in mind is, again, as I mentioned before, there are so many things to help you, and SOAR TA Center has actually gone to the extent of creating a VA caseworker's guide. So not only does it talk about SOAR and idiosyncrasies of their target population, but it also goes into the lingo of the programs that are used by the VA, including computer programs. So looking at that VA caseworkers guide could be very helpful, and in addition, there's also an SSVF and SOAR integration toolkit that you can see online. So just a little reminder too, the SSA disability benefits can provide access to veterans in the form of income, because veterans can actually receive SSI, SSDI in conjunction with or as an alternative to the VA disability benefits and employment. And as far as health insurance, veterans can use the Medicaid and Medicare health benefits that comes with SSI, SSDI to supplement the VA health services as well. Another part of SOAR's expansion effort is through the criminal justice realm. A couple years ago, the SOAR TA Center put out an application request for people to submit and say, hey, we want to start some kind of effort for those people that are leaving institutions, such as the criminal justice environment, before they get back into regular population. So 2017, the Consumer Health Coalition project in Pittsburgh, PA, was awarded one of the 6 national TA efforts. And with that, the TA Center came in, worked hand in hand with everyone. We had 2 Social Security Administration representatives working with us very closely, and representatives from all kinds of different county, state level organizations. And we came up with a process, and within 1 year, we had the process nailed down. We had a very strong steering committee, and 7 applications were approved, were sent through the system for consideration. The other way that SOAR can be expanded is to integrate it into the continuums of care. So everyone knows that the continuums of care have been charged with having a coordinated entry process. The information that you're going to get pretty soon from Colleen is going to have the SOAR and coordinated entry issue brief, as we call it. And it reviews things saying, as mandated by the HERTH Act, communities funded by HUD's COC program are planning and implementing coordinated entry systems. As these systems are implemented, it will be important to identify individuals who are unable to work and may be eligible for Social Security Administration disability programs such as SSI and SSDI. Incorporating disability-related questions into a community's coordinated entry system can assist in identifying potential SOAR applicants. And once a potential applicant has been identified, he or she can then be referred to the appropriate agency and SOAR-trained case manager for further services. So we have 16 different COCs in Pennsylvania, and each is working very differently, just as any counties do in Pennsylvania. So everyone's at a different stage. I will point out that we have managed to have the York COC start a very strong SOAR program, and they're doing 2 trainings a year through that to help bolster the effort to help those people that fall through cracks in other ways. Keep in mind, too, that while a lot of the COCs are using the VI SPDAT for their prioritization process, that there are certain indicators on the VI SPDAT that also might point to someone being a proper applicant for the SOAR process. such as a very long period of homelessness, or they're over 45 and have daily substance abuse use and diagnosis of Hep C, or they've had frostbite or other cold weather injuries. A lot of these things can be an indicator that this is also a potential SOAR referral. And finally, as Karen noted previously, it takes more than one element to make the whole system work. So you need an organized, well thought out coordination, and you need all your resources in place too. Anyone that's setting up a SOAR process, just for the sake of time, since we have questions to get to yet today, will be more than happy to talk about all the implementation needs when you're setting up SOAR in your community. So you've learned about all kinds of effectiveness things. You've learned about the advantages of using SOAR. So now you're like, well, how does that work financially? How do I fund this wonderful effort in my organization? And, you know, as we mentioned before, there's no money coming from SAMHSA. This is an initiative, not a grant. So you got to get a little creative. I like to think of the funding strategies for SOAR kind of being a parallel to getting scholarships when you're going to college or getting any other kind of education. There's a niche for everything. So you can use some of your outcomes to leverage some resources. For instance, if you're making a case that after your first 10 applications, you've saved a hospital X number of dollars that they were writing off previously, that can make a case. That hospital might then look into sponsoring a SOAR position so that people can actually have SOAR applications done and not have to have their health benefits written off. And people might not then also use the ER as their general practitioner. There are a lot of things listed on this slide, but I'll just point out some of the things that Pennsylvania specifically has done. Allegheny County has had a fantastic procedure with Mercy Behavioral Health Group. We have 4 people doing SOAR out there, and I've just recently been told that we'll be adding 2 more people that are doing full-time SOAR work, so that's fantastic. You can use CABI grants or cooperative agreements to benefit homeless individuals. Your Way Home has done this in the past, where they actually had hired an attorney to do SOAR processing for a full year. There are sometimes leftover resources from other funding streams. Franklin Fulton did a training for SOAR where they had approximately 20 people come in, and the deal was that, hey, we're going to pay for you to get trained, so that means we're going to pay for your time for training, we're going to pay for your travel back and forth, and in return, we hope that you will do 2 applications within the first calendar year after you're trained. Greene County also used funds from a Staunton grant. So with that effort, Rita Massey has gone out and done many trainings in different areas while the grant lasted there. And recently, the Home for Good project was come about as a result of the partnership with the PHFA and the Federal Home Loan Bank of Pittsburgh. So Delaware County will be coming back next year and giving us some exciting results, I'm sure, with their involvement with that. Another place you can look inside Pennsylvania is the Department of Community and Economic Development Funds. You just never know. You need to be creative and just keep an eye out, because just as scholarships come out, there are all kinds of people that say, I want you to be X, or I want this population to be served. And just as with grants too, there are little rules because they want it skewed to that population. So just be aware of all those different potential things just in Pennsylvania, but overall there are coalitions, cooperative giving programs, corporate programs. There's sometimes state, county, and federal funding. For instance, with the criminal justice push for SOAR, the GAIN Center has been a very good source. The VA obviously might be very interested. Community Mental Health Services Block Grant might be another avenue. Hospitals, private funding, and any kind of criminal justice system might balance that out. So, just a visualization, and this will be coming out to you in the message from Colleen. This chart shows the flow for both SOAR programs run by government entities, such as cities, counties, and states, as well as the flow for those run by nonprofits. And now I'm going to turn it back over to Karen quickly and talk a little bit about the housing and employment aspects.
So I'll just touch on this briefly. Go ahead. So working for more than an income. We know that work has many positive benefits beyond income, including a sense of purpose, connection to others, and it's a critical step in recovery. However, it needs to be the person's decision, so don't judge if the person's not able to work regardless of reason. If there is an interest, connect the person to work support programs such as SSA's Ticket to Work or supported employment programs. And there's a resource page later, but I wanted to make sure I mentioned there's a it's still 2018 on their website, Red Book. They'll probably be coming out with the 2019 version soon. But it's a very good resource. It's from the Social Security Administration, and it's a summary guide to employment supports for persons with disabilities under SSDI and SSI programs. So that might be something you might want to check out. This next slide is really talking about some of the myths around being able to apply for SSI, SSDI if you're working, and there is a myth that if someone works, they won't be eligible for SSI or SSDI benefits, or they will lose their benefits. Applicants can work and earn up to the substantial gainful activity amount per month, which is $1,220 for 2019, and those folks would still be eligible to apply. And there is no limit to the number of hours someone can work and receive disability. The Social Security Administration looks at the type and the amount of work. If the applicant is making over the substantial gainful activity amount, they will not be eligible for benefits. So if they apply and they're not making over SGA, but then after approval they continue to work, it's important to report their income to SSA. You don't want to have to get involved in an overpayment situation. But the Red Book is very helpful in laying some of that out for you. There will be adjustments made to the SSI, SSDI amount when working, and certain amounts of earnings are excluded when calculating countable income. That's also discussed in the Red Book. And if individuals are able to work and earn over the substantial gainful activity amount during seasonal employment or non-seasonal times, then continuing to work and/or employment supports may be the better option than applying for SSI, SSDI.
And just so you know, yes, you're going to get another handout, but this one, since the whole I can't work while I'm applying for benefits thing is such a strong misnomer out there, we are going to send you a yes, you can work. This is an actual myth and fact handout, and we're also going to send you an employment conversation guide that gives you some sample responses that you can do or give while you're working with people that are under that impression mistakenly.
So getting housing providers involved, how does housing fit in? There will be a handout shared called Housing Access and Stability with SOAR. It's an issue brief. It provides examples of partnerships. And it's likely the local lead and SOAR workers have connections and partnerships already with their public housing authority, housing providers, continuum of care. They should be invited to be a part of your local SOAR planning group. They know where the housing is, what housing resources are available in your communities. There is a public housing authority in Pennsylvania that does SOAR, and they are, last I knew, they were getting ready to hire another SOAR caseworker. Since SSI, SSDI application is typically approved in 3 months, most people coming into housing with zero income will be able to partially contribute to their housing costs over time, thus stretching PHA's housing choice vouchers. And this is the resource page I mentioned. So the Social Security Red Book is the one I want to point out to you in case you want to learn more information. I'll turn it back over to Michelle.
All right, so now we found out, oh, wow, there's a super cool program. It helps people, and our people are part of the population it helps. So how do I get trained? Well, Pennsylvania is using the SOAR online course to do our training. Why are we using this? In the past, there was another methodology that was a 2-day lecture format called Stepping Stones, but what we found were of the 600 plus people that were trained, only about 25 felt confident enough to then go out and do SOAR applications. So we went to a more hands-on process. So the new SOAR online course actually walks you through. It's so realistic. You have to fill out the forms, turn them in. You have to watch videos and take notes and make your medical summary report for disability determination. It's an absolutely fantastic interactive piece. The pieces are judged as you turn in your different forms and materials by the SOAR TA Center, and they will give you very helpful feedback. The price on this, well, it's free. Did I mention free? Free is good. It's web-based and it's self-guided, so you could have a plan to finish this in a straight 20-hour period, or you could, separate this over weeks, etc. And the other good bonus is that there are 20 free, did I mention free again, CEUs from the National Association for Social Workers for completion. And that 20 free CEUs does apply to both the adult curriculum and the child curriculum that is very new. So as I mentioned, the SOAR online course, as you can see on the right-hand side, that's Colette. Colette was the person I had when I went through the online course, and it's amazing the things that they show and point out as you're going through and writing up and painting that picture for everyone. And for the sake of time, I'm going to just let you know, doing SOAR is a fantastic thing, and I obviously will advocate that to any agency that can do it, but you need to be realistic. This is a time commitment. The 20 hours it takes to do the training is one thing, but then it takes about 20 to 40 hours to complete an application. Do you have time for that with your caseload? Do you want to work on appeals level? Do you not? Please note that if it's not following all the SOAR critical components, it's not a SOAR application. So make sure that this will actually be something that benefits both your agency and the people you're trying to serve, and I'll be more than happy again to talk to anyone about their concerns. One more happy face for you. And so your next steps, if you want to learn anything else, the SOAR website will be posted here soon, and reach out to me, register for the online course. You can always take the course just for your own edification as well. You don't have to do SOAR applications just because you've completed the course. And feel free also to get in touch with the SOAR TA Center. These are the additional resources that I mentioned. And also, there is my contact information. Feel free to make me earn my paycheck. With that, we're going to go ahead and stop and let Colleen open up the lines for any questions.
Sure, great. Thank you, Karen and Michelle. I do see some written questions, so we'll address those first. Catherine asked, is the medical summary a SS form that the representative fills out?
The medical summary report is not a Social Security Administration form. That is only part of the SOAR process, and there are templates for that provided with the SOAR training, and I can go into more detail offline if she'd like.
Great, thank you. And Lisa asked, who assists consumers with the appeal process?
That's kind of a trick question. Each person that takes the SOAR course, and assuming that they're with an agency, that agency dictates whether or not that person can work on the appeals level cases. There are some agencies in Pennsylvania that will work on that level, and some that, whether it's for time's sake or manpower, et cetera, that is not an option.
There might be, if the SOAR worker isn't able to do that, maybe the legal aid office in your area or even private lawyers would do appeals if they think they have a good case.
And vice versa on that too, because we've had people that had paid for lawyers and had paid for people to help them that didn't help them properly, and SOAR people went in and applied the SOAR methodology afterwards and were able to help it too.
Great. And Christine asked if there was a certificate for today, but today there is no certificate. As Michelle mentioned, there is online training that you can do. April asked, She said that she was told that our local Social Security Administration did not help with SSI, SSDI applications.
I'm not quite sure what she means by that. Is she saying that, I'm not sure what she means.
They don't actually do the application itself. They're doing the review of the application, and they're working with the SOAR worker on the process. There may be something specifically they want the SOAR worker to submit in a certain way, but they're not actually going to assist an individual in doing the application. That's the work of the SOAR worker. Does that help answer the question?
I believe so. Catherine also asked, is there a listing of SOAR reps that an agency might be able to access?
Funny you mention that. We're right now in the midst of building a database of SOAR providers, which will give the agency they work with, the email, the phones, do they or don't they do, appeals level, are they using OAT, et cetera, et cetera. It has not been finalized yet. We are using money from the Community Mental Health Services Block Grant to create that database, so I will have to give an update. As of now, if you have questions on who's available in your area, feel free to give me a call, because the TA Center gives me a list of people that have taken the online course and completed it, and I also have as I mentioned, there aren't very many, but I have the list of people who took the previous training and have been doing applications as well.
Great. And Sarah asked, how can a legal services organization get involved in SOAR? Can attorneys get paid to work as an independent SOAR advocate?
Can you repeat that?
Sure. So Sarah's first question was, how can a legal services organization get involved in SOAR? And her second question was, can attorneys get paid to work as an independent SOAR advocate?
Well, anybody that completes SOAR applications cannot get paid to do so specifically for doing SOAR applications. That's part of the SOAR process. They didn't want people to do this for profit. So when you are filling out the forms that allow you to get the information, as well as the person that you're applying with, part of that form completion is acknowledging that you cannot be paid for providing SOAR services. I know that's just not going to make a lot of people happy, but the other part of that is, how can a legal organization get involved?
Yes.
Well, HAP actually is a legal organization, so maybe we can do some connections there and they can brainstorm on that aspect. But obviously, a legal organization could have knowledge of the SOAR process if they'd like to utilize it, but again, you're not going to be able to bill for that time. I'm not as familiar with the billing aspect with legal, so I don't want to overstep my bounds. But we can brainstorm that offline too, and I can also talk to the TA Center and get more information. That's a good question.
Great. Karen from AGAPE said, I've been doing this work without being connected with SOAR. If I would continue with this, how many clients would I be required to see? Is it time consuming?
There is no actual requirement from the SOAR program in Pennsylvania of how many you do. Your organization may have ideas of how many they'd like you to do if you're performing SOAR as part of your job. And I forgot the other part of the question. What was the other part?
Is it time consuming?
Oh, time consuming. That's kind of a tricky question too. I mean, if you're working with like the VA could have a faster turnaround, because essentially all the places that they're reaching out for information are, as we like to say, in a little town. So if you're in a criminal justice environment or a VA environment where all the information you need is very attainable, you could turn around a SOAR application in 2 or 3 days. But if you have to reach out for that information from entities outside your own walls, per se, usually they average 20 to 40 hours per application until you get the information back and write up the medical summary report and submit.
Great. And Pat from HAP in Philadelphia asked if you could comment on the introduction of SOAR for children. They're very excited about that.
SOAR for Children actually was first released in October of 2018. Currently, Pennsylvania has 3 pilot stations working on children's SOAR applications at this time, and we're going to be reconvening in about a month or 2 to see how that process is going. But if that person wants to get in touch with me, we'd be happy to talk to them about organizing an official program, especially in the HAP organization, because of the groupings and the referral sources that they have in place. And of course, there's always the separate child curriculum that could be taken online in the meantime. Does that help?
Great, yeah. And Sarah asked, where do you find individuals that need assistance with SOAR, and how do you get the word out about SOAR?
How do you get the word out about you doing SOAR? Is that?
I believe the SOAR program, yes, and how to do SOAR.
Well, I'm in a lot of different meetings, and I bring SOAR up everywhere. For anyone that has been in COC meetings, you've probably seen me visit those and promote SOAR. I also promote it across the PATH, Projects for Assistance in Transition from Homelessness program. As far as how an organization could potentially promote that, I mean, you could work with your COC, you could promote it as part of something in your lobby to your agency, you could coordinate with referral sources and educate them so that they know what a proper referral source or referral is, as well as the fact that you're doing SOAR applications. There are a lot of different ways to go about that, so I'd be happy, again, just because we're coming up on 1 o'clock, please feel free to give me a call or email me, and I will be joyous to talk about spreading the SOAR program across more and more areas.
Great. And if you do want to ask your question via the phone, you can press *7 on your phone keypad to ask a question to Karen or Michelle. We do only have a couple more minutes, but if you want to press *7 to ask your question, you can.
Or if we didn't answer your question, previously answered question thoroughly enough and want to add to that, please feel free.
Lisa did ask, who is available in Harrisburg, PA for SOAR?
Please give me a call, and I'll get you connected to the right individuals.
Great. So one last call for any questions, any comments anybody may have. Feel free to write them in the chat box, or you can unmute your phone by pressing *7.
Hello, this is Pat in Philadelphia. Can you hear me?
Yes. Hi, Pat.
Hi all. Thank you for this fantastic presentation, and I am so impressed by this PowerPoint, and the graphics are fantastic. So I just wanted to point out a couple things from Philadelphia. One thing that we do really differently here is that we submit the medical records and the medical summary report, we call it a function letter, directly to the DDS adjudicators. What do you think about that? I mean, that's worked well for us, so I'm just kind of throwing that out there.
Is this HAP?
Yeah, this is Pat at HAP, Pat Malley.
Okay. If you have that relationship with your BDD office, I think that's fine. I don't know if and obviously you'd have a relationship with your Social Security office. So, yes. I mean, Social Security is only going to be determining the financial aspect and then passing all that information to BDD. So you're essentially just skipping having Social Security hold on to it and sending it.
Yes. So we do file the consent and the 1696 to preserve the 60 days, and then during that time period we further evaluate the case, which is the big screening piece, and then we go forward and file the cases that are strong enough, and then once they get to the adjudicator, who's a specific SOAR adjudicator, here at RBDD, then we submit all the material directly to them. So I just throw that out. That has worked really well, so that's just sort of a little bit of a different approach, I think.
But you're still doing the MSR and everything that is part of the SOAR process, so as long as it's meeting all the critical components and the relationships are established to do so, that I think that's fine. I will caution other places before you assume that you can do that. It's not an automatic. I'm sure, Pat, that you had quite the build-up in communication and trust to get to that point, yes?
Yes, absolutely, and you guys covered that totally on the PowerPoint. It's the relationship with Social Security and the relationship with the DDS, absolutely. But it's still the same critical components, the letter of support or the medical source statement, collecting the medicals, those are all the critical pieces. Yep.
And just to let anyone know, when we do have new people, we have a Social Security person that's willing to work with us as, say, Butler County gets someone, a new team of SOAR people trained, and we know that there's going to be an upswing in the number of SOAR applications there. Our representative will work with that local SSA office to get a person appointed to be the contact for SOAR and kind of streamline things as well. It's not quite the same as what Pat's describing, but it's kind of a similar situation to take any barriers out of your way from being able to complete the SOAR process and help your population.
Yes.
So I think if it's working for you, Pat, and no one has issues with it, and you've already established the communication, and you should be okay.
Yeah, and I think, like as you said, the key SOAR point people at the field office and or at the DDS are really great if you can get to that point.
Absolutely.
Yeah.
And kudos again on the turnaround and the application approvals. You guys are amazing.
Yeah, thank you. And feel free if anyone needs to reach out for anything. Thanks to the TA Center, you guys have been with us since the beginning, as you said, over 10 years ago. So it works. SOAR works, right?
Oh, it works.
Yay, it works.
Great, and we are a little bit over time, but there's one last question from Christy. She wanted to know if someone qualifies for SOAR, but they are hard to get in contact with, and SOAR stops reaching out to them. Is there a time frame where they can reapply again?
That kind of depends on where they are in the process. If you've already set up your filing date, you have 60 days from the date that you set up your protective filing date to turn in all the supporting documentation, or you then have to essentially start over again. So if you can't get a hold of them for more than 60 days, you've now lost that window to keep the earlier filing date as your start date if it's an SSI application. So you'd have to start with a new date, which might be months, years, however long later. Does that make sense?
Yes. Great. Thank you, everyone, again for joining us. I want to thank Michelle and Karen for presenting today. We really appreciate it, and I want to thank all of you for your time. And like we mentioned in the beginning, a recording of the webinar, the slides, some of the additional information that Karen and Michelle mentioned, as well as the video, will be sent out at the end of this week. So thank you all again, and thank you, Michelle and Karen, and everybody have a great rest of your Wednesday.
Wonderful, and thank you for having us.
Thank you.
Thank you. Have a good day.
You too.